Why are women flocking to functional medicine like a moth to a flame? In fact, my practice is approximately 75 to 80% women. And there are a bunch of reasons why, primarily because they need it. It doesn't take long once you learn about functional medicine to realize it attracts primarily women. Why? Well, the first and most evident reason is that chronic disorders affect more women than men, and conventional medicine's treatments of women often ranges from disappointing to dehumanizing. In fact, it's estimated that women are 4 times more likely to suffer from some type of chronic disease than men. Let's not mention the fact that women tend to make better patients than men. So no offense, guys, but for how much we tend to be the fix-it guy or type mentality, when it comes to actually fixing ourselves or our health, we kind of suck at it. For one, a lot of times guys don't like someone telling them what to do, plain and simple. And secondly, with the way our society is, and even more so with guys, if they don't get an immediate reaction or result, then we tend not to stick with it. Well, I have news for you. That's not how getting healthy works. So conventional medicine has been failing women. When women show up at doctors' offices with mystery symptoms from chronic disorders, they're often left feeling demoralized and hopeless. It's very sad. So what are some types of areas conventional medicine fails women? And unfortunately, this is by no means a comprehensive list. Autoimmune diseases overwhelmingly afflicts more women than men and cause years and even decades of symptoms before diagnosis. Many women are told to exercise more, meditate, or take antidepressants for their symptoms, but are not really given any real solutions. Another all too common comment I hear with many types of conditions, but particularly with autoimmune disease, is your symptoms/condition is not bad enough. So come back when things get worse or progress, and then we'll do something about it. Yeah, I don't think so. That's just crazy talk. Essentially, what this breaks down to is that you might be in the early stages of some autoimmune or chronic disease, but not technically have the disease. They're saying, wait until you actually have it, then come see me and we'll give you medications to cover up the symptoms and give you other symptoms. So why not try to stop or reverse it first? Chronic fatigue affects 4 times as many women as men. However, these women are simply told to exercise, as many doctors don't believe in chronic fatigue, even though it's now medically recognized. These women often end up feeling worse. There can be many different reasons for chronic fatigue, from adrenal fatigue, low iron, low thyroid, malnutrition, gut dysfunction, and parasites, just to name a few. Maybe we should look at those things first. Also, pain is undertreated in women. The studies show doctors are slower to treat pain in female patients in the emergency rooms and generally undertreat women for pain. Fibromyalgia, a disorder of chronic pain, also affects mostly women and is often regarded as not legitimate. In fact, some researchers believe disorders such as fibromyalgia and autoimmunity are so frequently belittled and dismayed because they are predominantly women. So the rates are actually higher than what are reported. Another issue is that women have worse outcomes from heart attacks because medicine looks at male-based heart symptoms. For instance, many women do not have chest pain. It can often present as stomach pain similar to gallbladder problems. And as a result, treatment is often less aggressive than necessary. If there's one place where many women lose their faith in medicine, it's during hospital childbirth. Women are often pressured into unnecessary procedures or left hung out to dry emotionally in the event of a problem or emergency. As a result, many leave the hospital with postpartum PTSD. Female sexual abuse survivors also experience worse symptoms in these scenarios. Male-based studies don't translate to female patients. Most medical models are based on male physiology. As a result, many signs and symptoms that present differently in women go misdiagnosed or dismissed. Autism and heart attacks are 2 examples. Plus, women experience chronic diseases such as autoimmunity, fibromyalgia, and hypothyroidism at significantly higher rates than men and are thus often told their symptoms are in their head. Guys and doctors, making a comment like this is the last thing anyone should do, let alone a doctor. You should never minimize a patient's symptoms. Number one, it's just rude. They don't know, you don't know, or they don't know what someone else is feeling. So don't tell them it's in their head. Now let's be honest, women are more delicate in general, And this is partly because there's a lot more going on inside of women than a man. More moving parts equals more things to potentially go wrong. They have a monthly cycle in hormones, which is a delicate balance or dance of hormones. They're built to carry babies. They tend to be smaller, so outside forces such as toxins can affect them easier. And since their brains are wired differently than men, obviously, stresses affect them differently. And this is the short list. Fortunately, functional medicine is there to help. We conduct comprehensive histories, examinations, and testing with all of our patients, regardless of gender. Some of the testing that we routinely send clients for might include blood, urine, stool, hair, saliva, and anything or everything else that might be needed. We don't leave any stone unturned. We're looking for the root cause. We specialize in working with chronic so-called mystery disorders that predominantly affect women and are explained in scientific literature. One thing that we frequently hear from women is how good it feels to finally be heard. So there you have it. Functional medicine can help you. I'm Dr. Craig Mortensen. Be healthy, be happy.